Welcome, everybody, and thank you so much for joining today. We so appreciate you taking the time out of your busy schedules to join. Just going to give it a quick moment to allow everybody to enter. Welcome, everyone. As you arrive, we would love if you would introduce yourselves in the chat as you come in. But thank you so much for joining us today. We can go ahead and get started. I'm really pleased to be here with you all for our event focused on the WHO HIP Matrix tool, a resource that helps link the WHO guidelines and the family planning high impact practices. To set the scene for everyone, the idea for this tool first came about in 2018 after a survey was conducted to better understand how FPRH professionals use the WHO guidelines and the HIPs in their work. And the initial survey results showed mixed results. Many professionals initially said that they were aware of the WHO guidelines and really valued the importance of these resources, but they did not consistently reference them. On the opposite end of the coin, many survey respondents said they were familiar with the HIPs, but use of the HIPs was also mixed. And survey respondents shared a desire to better link the HIPs to evidence-based guidelines coming from organizations like the WHO. So based on this feedback, the WHO HIP Matrix tool was launched in 2020, and myself and my fellow panelists today are really looking forward to helping you get more familiar with this tool. Next slide, please. All right, well, thank you again for joining. My name is Aoife O'Connor, and I'm a program officer at the Johns Hopkins Center for Communication Programs, where I support the Knowledge Success Project, and I will be serving as the moderator for today's session. Next slide, please. All right, so first things first, before we get too far, I want to cover a few quick housekeeping items. First is to note that this presentation has French interpretation available. So for anyone who would like to listen in French, please do click the interpretation icon on your Zoom screen and then select your preferred language. All right, next slide, please. All right. Additionally, this webinar is being recorded and will be available in both English and French after today on the Knowledge Success YouTube channel. And we will be sharing a link to this channel at the end of our webinar today, as well as in a post-webinar email that you all should receive. And lastly, before we dive into our agenda today, we want to share the links to access the WHO HIP Matrix tool that we will be discussing today, which you can find on the HIP's website. So the tool itself is available in English, French, Spanish, and Portuguese. And if you'd like to follow along during the presentation, I believe my colleague Anne will be sharing a link to the English and French versions of the tool in the chat right now. All right, next slide, please. Wonderful. So we're going to go ahead and just take a quick look at our agenda for today. For those of you who may be less familiar with the HIP, I am going to be starting our session today with a brief overview of the Family Planning HIP brief. And following this, we'll be hearing from Ottos with the IBP Network, who will be providing a comprehensive overview of the WHO HIP Matrix tool itself. Ottos will also be sharing some exciting previews related to the 2025 upcoming ICFP conference with the planning that is underway. And we'll be sharing an opportunity for you all to learn how you might be able to get involved. Then after you have all come to learn how the Matrix tool works, we are very grateful today to be joined by three esteemed FPRH and HIPS technical experts who will be responding to some of the questions that you submitted when registering for today's event during a live panel session, where these colleagues can speak to the real world impact of the HIP and the benefit that a tool like the Matrix tool can provide for FPRH program managers and implementers. So with that said, let us go ahead and get started. Next slide, please. Thank you so much. All right, so to kickstart, we wanted to begin with a quick introduction to the family planning high impact practices, or the hips as many people know them. And this is to give everyone a strong foundation before introducing you to the WHO HIP matrix tool. So the HIPs are a set of currently about over 20 evidence-based family planning practices that have been vetted by experts that have demonstrated impact on FPRH outcomes that are applicable across settings and regions and that are scalable, sustainable, and cost-effective. But maybe one of the most important features of the HIPs is that they are also documented in a way that is accessible and easy to use. It's really designed for a main audience of policymakers and FPRH implementers. And again, as I'm talking, my colleague Anne will be sharing a link for the main website to explore the HIP brief, which I certainly encourage you to take a look while we're discussing today. All right, next slide, please. So both on the screen here, or maybe if you have opened the link and you're looking at the briefs yourself online on the HIPS website, you'll notice that the HIPs are grouped into 3 primary categories, which reflect the different aspects of family planning programming. These 3 categories include the enabling environment, service delivery, and social and behavior change, or SBC. Each category plays a crucial role in the overall effectiveness of family planning interventions. And additionally, there are also what are called HIP enhancements, which are additional family planning approaches, but that are not necessarily standalone practices, but when they are combined with other HIPs, they can amplify the impact of family planning interventions. And these enhancements are often used to extend the reach of a program or make it more effective for specific audiences. So for example, adolescents or other marginalized groups. Next slide, please. All right, so on this slide here, you can see the many examples of the family planning approaches that have been categorized as high impact practices or enhancements. Such as providing family planning during the postpartum or post-abortion periods, which falls under the service delivery HIPS category, or say using community group engagement interventions that aim to foster healthy sexual and reproductive health behaviors. So the HIPs themselves each have their own brief landing page that provides extensive background and evidence on that individual practice. And the brief also gives helpful tips and resources on how to implement the practice, including things like common barriers faced by implementers, and even looking at indicators on how to measure progress when implementing these practices. So all in all, the HIPs are a really critically important tool that can help support program managers, policymakers, and other FPRH technical professionals in implementing evidence-based family planning programs. And today we're very excited to expand your HIP knowledge by introducing you to the WHO HIP matrix tool that we hope can help illustrate how you can integrate the HIPs with additional evidence-based global guidelines. And so my colleague Ados will be leading us in the introduction of that tool today. So if you don't mind skipping to the next slide quickly. So I'm delighted to introduce Ados May, who is a technical officer with the WHO IBP Network and who specializes in supporting the over 100 partner organizations of the IBP Network in their work to disseminate, integrate, and scale up the use of the WHO guidelines and the HIP. So over to you, Ados.
Thank you, Aoife. Thank you for the introduction and greetings to all our participants. It's so exciting to see so many of you joining us today, over 130 people. It is my pleasure to present on the Matrix today on behalf of the WHO IBP Network and the HIPS partnership. Next, please. Next. So the Matrix tool is a short 4-page document. If you use it online, it has lots of embedded hyperlinks to take you to other resources, such as the HIP briefs and the WHO guidelines and tools. If you print it out, it is a handy, quick reference to have on your bulletin board or your desk as you are implementing your programs. I'm going to walk through the tool page by page, starting here on page 1. which provides the background and introductory information. On the slides that follow, we'll zoom in to look at this page more closely, starting with the top section in gray. Next slide, please. Here on the top gray section, we have the challenge that this tool responds to. We also have the solution it offers, the goal, its purpose, and the audience that this tool is intended to reach. We developed this tool with program managers in mind, and especially those who are familiar with the HIPS, but perhaps not as familiar with WHO guidelines. Next, please. Thank you. Moving to the middle section of the first page, we see a description for the two main components of the tool, the matrix itself, which is on page 2, and the reference sheet on pages 3 and 4. The matrix provides suggestions for how the HIPS and WHO guidelines can be used together. The suggestions include advocacy, program design, provided reference, and training. So for example, the WHO guidelines can be useful in considering program design when implementing the HIPS, or can serve as a reference for providers when they are delivering family planning services through one of the high impact practices. The reference sheet on pages 3 and 4 provides some basic information on the HIPS and the WHO guidelines and tools. For those who are not familiar with a specific guideline or tool, it also includes more specific examples on using the guidelines alongside the high impact practices. Next, please. At the bottom of the first page, there are a few points for clarification. It is important to remember that WHO guidelines and tools are global documents, which, as you know, are often adapted to the specific country or program context. They might be incorporated into national service delivery guidelines or as a job aid or training tool, depending on the need. When these adaptations exist, they should also be taken into consideration along with other local contexts, guidance, and priorities. Next, please. So moving on to page 2, this is the matrix, and this is the heart of the tool. Look for the instructions on the top left-hand corner. First, choose which high-impact practice you're working on. The HIPS run along the top of the matrix, and here you'll see 8 that are service delivery HIPS. Note that these are only the 8 service delivery HIPS in the array of tools that the HIPS have. Then, if you look down to the first column on the left-hand side on the matrix, you can choose the WHO guideline or tool and find where its row meets the HIP column. Where they meet, there is a suggestion, or perhaps 2. You'll see how to use the WHO guideline or tool to support a HIP implementation. Again, the suggestions are advocacy, program design, provider reference, and training. So let's go a little bit closer to the next slide. So thank you. So let's imagine a team is considering implementation of family planning services through mobile outreach program, which is a high impact practice. So you see that shown in the matrix along the top row, circle in orange. We want to be evidence-based and follow global guidance from WHO, and we're looking for additional information on the appropriate tasks for different levels of providers participating in mobile outreach. So we look to the WHO guidelines, in this case, optimizing health worker roles through task shifting, circling green here across the screen. Following where the green and orange meet, the matrix suggests that there are 2 ways to use the WHO guideline. And those are in advocacy and in program design. For example, the WHO task shifting guideline can be used to support program design decisions, such as choosing the most appropriate providers to staff the mobile outreach for the services they provide, whether or not mobile outreach providers will conduct on-the-job training to local providers, etc. Second, as a global resource, the WHO guideline can also be used to support advocacy for mobile outreach approaches for reaching hard-to-reach clients with the services they need and desire. Next, please. Thank you. The final 2 pages on the tool are the reference sheets, which provide additional information about and links to the HIPS and the WHO guidelines and tools. We'll go a little bit closer to see this information. Next slide, please. So the Matrix tool, either if you have access that online or if you print it, if you have it in front of you, includes 6 WHO guidelines and 3 tools that are most relevant to family planning programs. They are shown here. Starting at the top and moving clockwise around the circle, there is the medical eligibility criteria for contraceptive use and its accompanying tool, the MEC wheel, in blue at the very top of the slide. Other guidelines include Optimize MNH, which is optimizing health worker roles to improve access to key maternal and newborn health interventions through task shifting, which is the orange and red guideline on the far right. The next guideline in gray is perhaps lesser known, but is a really great tool, which is ensuring human rights in the provision of contraceptive information and services guidance and recommendations. And then you can see other tools, including the family planning handbook, among others. So let's move to the next slide. Just as a reminder of something that Aoife mentioned in her opening remarks, the HIPs are the high impact practices for family planning are a set of evidence-based practices vetted by experts against specific criteria and documented in an easy to use format. Each HIP is comprised of an 8-page brief that brings together the most relevant evidence and information for use in advocacy, strategic planning, program design, and others. And this tool that we have been introducing here today focuses on the 8 service delivery HIPs. Next, please. On the reference sheet that can be found on pages 3 and 4 of this matrix tool, for each tool and guideline, there is an image of the cover and a hyperlink embedded in the title of the document. Then there is a brief description of the purpose of the guideline. For the guideline on ensuring human rights, for example, the goal is to provide guidance on actions that should be taken to ensure that human rights are systematically and clearly integrated into contraceptive services provision. Then for each guideline, there are 1 or 2 bullets that describe how the guideline can be used alongside the HIP through the relevant actions, whether that action is advocacy, training, program design, or serve as reference to a provider. Those are shown in bold. This guideline can be used to support rights-based advocacy for implementation and the scale-up of high-impact practices. It can also be used in developing training materials for providers to ensure rights-based care when implementing HIP services. Finally, there is a specific example of how the guideline can be used alongside a HIP. These examples hopefully bring the possibilities to life, providing more specific inspiration for integrated use. Next, please. I'd like to thank everyone who reviewed and provided input on this tool. Like everything we do at the IBP Network, this was a collaborative effort. The many people listed on the slide here provided substantial review and input in the many drafts that took for this tool to be finalized. And I also want to thank Knowledge Success for co-organizing the webinar today. But before I go, I also, I also want to share with you an exciting opportunity to put to use this particular tool and other high impact practices and WHO guidelines by being part of the International Conference for Family Planning Program Implementation Subcommittee. This is a subcommittee that IBP, alongside partners listed here, co-chairs. And the objective of this subcommittee is really to bring the perspectives from across regions and across sectors to the conversations at the conference. We also want to create an equitable, collaborative space where different experiences, languages, and geographies are represented in implementation of family planning programs. And we also want to encourage partners to push the boundaries to achieve their vision of sustainable development by investing in family planning and supporting resilient health systems and services. There is a link here to join the subcommittee, as well as it will be sharing the chat window. And with that, I want to thank you and over to you, Ifa.
Fantastic. Thank you so much, Otto. And yes, just wanted to reiterate and encourage everyone to please explore the resources that were shared about the ICFP and the possibility of getting involved. We're certain that the HIPs will be present in the dialogue at ICFP, and I know we're all looking forward to gathering together as a family planning community. So please scroll up in the chat if you didn't see those links at first to learn more about how to get involved. And thank you so much, Ottos, for a fantastic introduction to the Matrix tool. And next, all right, if you don't mind advancing, I think just one more slide, please. Thank you so much. I am now thrilled to be able to move into the panel session of our webinar today. So I'm delighted to be able to invite up our three colleagues that we have joining. We have a truly spectacular lineup of panelists. So before we get started, I'm just going to provide a few quick introductions. So joining us today from, I guess, left to right on my screen here, we have Lois Sunthali, who with us, who is a family planning advisor with the USAID Zambia mission. Lois is a seasoned reproductive health specialist who has over 30 years of experience of managing and implementing both family planning and maternal and child health programs, both from the community up to the national level. She also has extensive experience with programming around and advocating for the HIP. So thank you so much, Lois, for joining us. And then next on our panel, we are joined by Dr. Abdulmumin Said, who is currently serving as the Deputy Editor-in-Chief of the Global Health Science and Practice Journal. So Dr. Said has over 20 years of experience supporting family planning and epidemiological research and programming in many different capacities and countries at academic institutions, NGOs, as well as prior work as a senior advisor at USAID. And one thing we're grateful for as well is that Dr. Said actually played a large role in the review process and development of the Matrix tool. So we're certainly delighted that he is able to join us today. Thank you so much. And then, of course, to round out our panel, we are very lucky as well to have Dr. Mario Festin join us from Manila, who serves as the director of the Institute of Reproductive Health at the University of the Philippines in Manila. So Dr. Festin has served as a member on the HIP Technical Advisory Group, has also held positions as a medical officer at the Human Reproduction Team at the WHO headquarters. Dr. Festin was also involved in the initial review and production of the Matrix tool. So additionally, we're delighted to have you join us here today, calling in from the Philippines. So thank you so much to all of our panelists for joining today. And we're going to go ahead and get started going through a few of the questions that were submitted by all of the attendees that are here on the call. But first and foremost, I think the first question that we would like to start off with today, I'll direct towards first to Dr. Feston and then Dr. Saeed if you'd like to add anything. Knowing that you both played a role in the development or review of the Matrix tool, I wanted to ask that because the Matrix tool was developed through such a collaborative process, can you share a little bit about your role in the development or review of the tool first, and then talk a bit during this process, what were some of the key challenges or the gaps that you hoped to see addressed by linking the WHO guidelines with the HIPs, and how did those challenges help shape the tool's design? So Dr. Feston, let me go ahead and start with you.
Good evening, good morning, good afternoon to everybody. I hope you can hear me well. Thank you, Ife, for the question, and welcome to everybody again. When I joined WHO in 2009, I was in the family planning team, and we were working on the different guidelines. So those were the evidence-based guidelines for the medical eligibility, the selected practices recommendations. So those are mostly how to use the different contraceptive methods. Then we had the different tools that supported it, like the MEC wheel and the family planning handbook and many other things. But WHO was also a partner in the development of the high impact practices. So the high impact practices are a little different, have a different objective in terms of what are they supposed to be, and this was adequately described by ADOS. The high impact practices are telling us how to implement the programs and the planning of the programs, whereas the WHO tools are to tell us what are supposed to be given or provided, the content of the programs. So there was a lot of discussion on how can we put these together, because those were both based on evidence, a very thorough review of the literature, a very good assessment by the panel of experts gathered in such for each tool. But the audiences are basically the same, but the purposes are different. So how do we put them together? So it was a very important task to put that matrix together, to see how they intersect, how they connect with each other, and how can one content be part of the other. It was very easy for one of the tools, the the family planning training resource package, because we felt that was going to be for all of the different high impact practices when we are going to tell people about them. But some of the tools of WHO are more for what the service providers will be giving. And most of the HIPs that are identified were in the matrix for the HIP matrix are basically for the service provider tools. So some of the difficulties in the beginning were related to really how to put the different components together. What are the intersections? What are the commonalities? And we really had to figure out that advocacy, the program design, and the training, and the other aspects, so that we will be able to give some guidance for those who decide to either approach it from the WHO tools and guidelines or from the HIP guidelines. So that was very useful, because whatever part you start from, you will be able to use the tool. So in the beginning, it was difficult to get this across, but with more and more experience and stories from countries, the we got more experience and more are able to relate this more to the use of the matrix. Thank you.
Thank you so much, Dr. Feston. And yes, I think your point exactly, that we know that there are many people who are first familiar with the HIPS, but not as much the WHO guidelines or vice versa. And I think this can be really valuable in uniting those communities, around integration of both of those best practices. So thanks so much for sharing that insight. Wanted to see, Dr. Said, anything else you would like to add?
Yeah, no, thank you, Ife, and thank you, Adus, and thank you to for the opportunity to be part of this important conversation. Good afternoon, good morning, and good evening from wherever you are around the world. And thanks to Mario, who we worked very closely at that time when I was a senior advisor at USAID Office of Population and Reproductive Health, and also managing USAID investments with WHO and also managing the IBP at that point in time. So with the Mario has said it all, but some considerations were actually the multiplicity of tools out there. You have the WHO guidelines, different tools, and also the high impact practices. So there tend to be some confusion in the field that what do we really use? Is it the HIPS or the WHO guidelines? But one important point that was highlighted is the need for that complementarity, how the guidelines can inform policy and also program conversations and what need to be done to deliver high quality EP and reproductive health services, while the HIPs are vetted evidence as already clearly described by others. So how do we really put this into use and also help countries design, especially the program managers, to design or implement programs that will improve the greater use of evidence? And with that in mind, that also informed the development of the tool. It was a collaborative process with input from different partners, different colleagues around the world. One key challenge is really pulling together those contributions and harmonizing those feedback and coming out with a tool that will be useful to the program implementers and to certain extent also play an advocacy role for ensuring integration of evidence-based practices, putting together both the high impact practices and the WHO guidelines. So I think, but again, being that collaborative process was an added value to the integrity and the usefulness of the tool to the field. And we're glad that we're having this conversation at this point. And thanks to all colleagues who contributed to the tool. Over.
Thank you so much, Dr. Said. It's very helpful and really interesting to hear about the origins and insights into how this all came to be and how we are where we are now. I want to move us into our second question for the day, which was shared and kind of synthesized from a few different comments that attendees passed along, which was kind of mentioning this challenge that often arises when attempting to better integrate best practices like the HIPS and global guidelines like the WHO guidelines, is that when this information is disseminated at, say, maybe the ministry level, it often doesn't reach frontline implementers and program managers. Yet sometimes there is an additional challenge that when projects try and engage directly with program managers, those program managers will often tell the project that they can only act if the guidance comes from the ministry itself. So this question kind of speaks to a bit of a disconnect about how training and educational standards are applied. And if you're trying to increase the use of best practices in a region, I guess who are the right stakeholders to connect with to really make a lasting impact? And so just wanted to pose the question, kind of based on the experiences here on the panel, what are some ways that you think we can bridge this gap? And I wanted to get started just to hand this over to Lois, if you don't mind sharing some initial thoughts.
Okay, thank you very much. Hello, everyone. Good morning, good afternoon, good evening. HIPS is a very important, I think, part of family planning programming. we always hear about new ways of doing things, and new ways of reaching the target population, and also indeed new ways and lesser, costly ways of implementing the family planning program. As we've heard already, HIPS covers enabling environment, service delivery, and advocacy. And of course, with all those new evidences coming out, there should be a link on how best we can link them to programming. What we have found to be helpful is kind of like incorporating all these steps into our programming. So we look at the enabling environment, for example. Is the policy environment conducive for us to implement that HIP? It's true, when the HIP comes, it will just remain at the national level, or it will just remain in the books and nobody will implement it. For it to be implemented, we have to follow certain steps. We are lucky in Zambia, we have a very strong national technical working group, which comprises of all donors, government, and implementing partners. This technical working group is an advisory body to the Ministry of Health. So when a new initiative comes on board, the National Technical Working Group will deliberate on it, will get presentations from experts who've used it or who have evidence on how impactful it is. And with that, we will be able to endorse that activity as something the country can adopt. The ministry, in turn, because they take us as an advisory body, they will endorse that HIP and incorporate it into the national guidelines for family planning programming. That way, it becomes easy for it to trickle down to the service delivery points and for all service delivery stakeholders to take it on board. It becomes a national initiative. Over.
Thank you so much, Lois, and really appreciate your insights and personal experiences with the technical working group to kind of speak to this as well. Also, just wanted to open up, see if anybody else on the panel has any additional thoughts they'd like to contribute, or happy to. Oh yes, Dr. Feston, please go right ahead.
Yes, usually the Ministry of Health would have better access to the WHO tools. But in a country, family planning program implementation and design is not only the Ministry of Health. It needs a lot of partners. It needs a lot of implementing partners and some other groups, including the NGOs, including those who are being supported by the USAID. And those groups have more experience with the HIPs. And the team get together and they discuss what could be implemented in terms of the content and how it can be implemented in terms of what are the programs that could be used, such as for social marketing or for training or for timing of the different designs for the programs. So a complementary discussion, not only in the content, but also in the way things will be implemented, will be used by both the HIPs and the WHO tools at the country level, because different people will be bringing in what they have learned from these materials when to the discussion points. So that's very useful. When I did an evaluation of the USAID program here, and we were talking to some of the, in the Philippines, we were talking some of the local government units. I was so surprised and very happy that they were actually mentioning the HIPs. They said that they were aware of it, they were using it, especially the service delivery HIPs, and I told and even asked them to test them. So that was the academic person in me, but they were able to answer it very well. So that is proof that putting things together would be more useful for the country. Over.
Thank you so much, Mario. Really appreciate your additional insight. I want to move us ahead to our next question now. And we'll flag that I think that some iteration of this question was probably the most common thing that comes up in conversation. And that was shared or expressed by attendees today. And this really gets to the point that so how could this tool be contextualized for use in a particular region or country, knowing that there are so many differences in the environments that we work, knowing that sociocultural practices vary, the capacity of our health systems vary. There are many other barriers, whether that's, trying to implement programs in rural or conflict-affected settings, or environments that are not as permissive or accepting of family planning. And so just wanted to ask you to speak to the process of implementing the HIPs and the global guidelines under different local contexts and conditions, and how a tool like this could be adapted. And so maybe Dr. Saeed, if I could turn to you.
Yeah, thank you, Ife. I think this is a very important question. And in every intervention, especially evidence-based programming and cost-effective programming, the country context is really key. It's not a one-size-fits-all, and countries should consider prioritizing interventions that may be based on quality or equity, or of course, what are the priorities and the resources the country can support those interventions, as well as the impact to scale up those interventions. And there are tools that can help countries do that. And one of the tools is, of course, the FP Goals model, but there are other tools developed by the FP Goals model is developed by the Track 20 project by IBP Health. And we've started similar process in Nigeria and some other countries like Kenya and Ethiopia. And one of the key advantages is to identify the high impact practices that present a very specific opportunity for countries to drive impact at scale. And with that, countries can use their local data to prioritize interventions that will lead to the most growth, and determine the level of scale up needed to achieve that specific level of growth, or to reach to reduce or to address equity issues in that country, especially as you mentioned, the conflict region, and identifying the groups that are most at need to use family planning or reproductive health services. In addition to the FP Goals model, WHO has recently released or started the process of rapid assessment of bottlenecks. I think there was a webinar recently that discussed that tool, which is a modular tool that help support assessment of bottlenecks, inhibiting scale-up of evidence-based practices in countries. And part of the tool process is really to bring those scale, to synthesize what is known about scaling evidence-based practices, including both the WHO and the high impact practices, and to understand perspectives of key stakeholders, including policymakers, program managers, and other relevant stakeholders in the country, and to build consensus among these key stakeholders around the priority interventions that can address the need of the country and priorities for the countries in terms of evidence-based practices. So with that in mind, putting both the FP Goals model and the equity lens, I think, and the country context, these are important tools that will inform and help countries identify priority interventions within the high impact practices and the WHO guidelines that will address the need of the countries. I know in the interest of time, maybe I will encourage colleagues to look at those tools and reach out to WHO colleagues and maybe the Avenir Health colleagues who might provide additional details on those resources that I've mentioned. But of course, country context, the government leadership is really key, and also prioritizing the interventions that best address the need of the country are also very key considerations for sustainable scale-up of evidence-based practice, including the high impact practices. I'll stop here.
Thank you so much, Dr. Saeed. And I will flag, so there were some great materials and tools that you mentioned in your remarks, and including Track 20 and others that I certainly hope if there are additional tools that attendees here want to share with everyone, please share them in the chat. But just noting that I have shared a link to the HIPS resource page, which includes a great number of tools that have been designed to support HIP implementation and scale up. So it's just a few of many that I would definitely encourage participants here to explore. So I know that this is such a popular question. I know we're in the interest of time, we'll move along, but just want to see if there's any short comments that anybody else would like to add on this one. Yes.
Maybe I can add. What we also find, before we incorporate the HIPs into our national guidelines, USAID has been instrumental in helping to pilot the HIPs. Currently, for example, we are piloting PPFP and PAFP. Postpartum family planning and post-abortion family planning, kind of like steering the HIP to our local country context, to a level that will be acceptable and accessible. As Said mentioned, we have to provide equity services. And so once those are piloted, then we provide the evidence on how best they can be implemented in our context, and that is what we inform the government to incorporate them in the national guidelines. We further go on to work with advocacy teams, the CSOs, so that they advocate, one, for the acceptance of the HIP and by the targeted population, and also the government to kind of like put it into their national guidelines as something that is beneficial to the people. Over.
Thank you so much. And Dr. Feston, I know that you had some thoughts as well, so please go
Very,
ahead.
very quickly. The HIPs are global documents. So you really have to review them and see which aspects can be adopted and adapted to your local settings. So that's really up for you to study them very well. And they are very good documentation of experiences and evidence already. My favorite part in the HIPS document is the implementation tips section. If you haven't seen that, go to one of the HIPs and there's a big section on implementation tips on how to actually implement those different recommendations in the HIPs. So that's something for you to work on in the next few hours. Thank you.
Thank you so much. Yes, I think our everyone here will be inundated with a lot of great resources. Again, encouraging individuals to explore that resources tab that was shared in the chat. There's an additional tool that was published recently, which includes a list of implementation and scale-up resources that support HIPS implementation. And it's just a large set of oftentimes over 30 implementation tools and case studies for over 8 of the HIP briefs so far that can be explored at that link as well. So lots of great resources at everyone's disposal and a lot to dive into. So thank you so much, both of you, for your comments. Moving to our next question here. So one of the things that was flagged, I see both in our Q&A questions here and in some of the questions leading up to our session, was that while the Matrix tool is specifically designed to support service delivery HIPs, I'm sure there are many FPRH professionals joining us today who also work in adjacent specialty areas, whether that's working on creating a strong enabling policy environment for family planning or working in the social and behavior change space. And so wanted to kind of frame the question of how can implementers who focus on these other HIP categories best leverage the principles and insights from the Matrix tool to strengthen their FPRH programs. I'll see either Dr. Feston or Dr. Said if you have any thoughts on this.
As I just mentioned, there is a section on implementation tips. So there are some aspects there in which you might want to consider the context in which the HIP recommendations will be adapted. We have always mentioned that we want to look at the social determinants of health, And for every hip, there is always the conceptual framework on the theory of change, on how we could change one practice into the other. So that is something that the other aspects, that the other colleagues in the partner groups can be able to look at in order to see how they can help implement the hips. The other thing I'd like to bring up is that all the hip topics are there for the meantime, but we still want to see if there are hip topics that can be included for future development. So as a member of the technical advisory group, we are on the lookout for new topics that can be nominated into new for development of the hips. So we can reach out to the hip tag in order to do that. So thank you.
Yeah, maybe quickly I can add here that the metrics tool, I think, provides a very important framework then that other professionals that are working in areas that are outside service delivery can begin to see how to map out those resources within the HIP and also resources within WHO, and where are those complementarities, where are there common themes between those resources, and how can that inform program design and perhaps advocacy for inclusion of those program implementation guides, international programs as general. And one consideration is for the HIP Secretariat to begin to look how best to update the current metrics based on the need out there in the field and available guidelines from WHO. That is a call for the HIP Secretariat to consider as way forward. But at the moment, I think the framework is, the tool provides an important framework that can be built upon on how it was developed and how to align. I gladly others really show how you can map, one can map the meeting point between the WHO guidelines and also the high impact practices briefs, and that will be very important to consider at the moment. Over.
Thank you so much, Dr. Said. And I think just
and maybe a last, just one question, since I have the attention of all the people that are doing the hips, I think we should also consider the measurement of hips. Some indicators that could guide implementation of HIPs. Obviously, we have family planning indicators, whether at national level or global level, but maybe just food for thought. If we could also kind of like track how are these HIPs being implemented and the measurements. Thank you. Over.
Thank you so much, Lois. Yeah.
So I can come in here quickly. Yeah, there is a joint effort between USAID and Bill and Melinda Gates Foundation on that measurement work, and I think that is ongoing, but I will leave it at that. Yes, thank you so much, Lois, for that suggestion, but yes, HIP measurement is really key. We can't do what we don't measure, so that is an ongoing process, but I'm sure the colleagues who are currently leading on that process would provide updates, maybe in the chat. I'm sure they are part of this webinar, and some of those comments might be coming in from colleagues who are already part of that process. Over.
Yeah, thank you so much, everybody. I know as well, want to call out, there have been some recent webinars and great work done by the R4S project and the measurement space. And those are definitely things to look into, and we can share those resources after today. So appreciate, there's so many fantastic resources and thoughts shared around this really expansive conversation. And so just as we're kind of wrapping up here, for the sake of time, I apologize, I'll have to ask you all to be brief, but just given our discussion today, I wanted to see if I could ask all three of you, what is one key insight or action that you hope everyone attending today will be able to take away from the conversation, whether that's around use of the Matrix tool or on the broader use of the WHO guidelines and the HIP. Maybe let me see if I can invite Lois to go ahead first.
Okay, thank you very much. So health is dynamic, it's always changing, and we are privileged to have a team that works on high impact practices, looking at new ways of doing business, new ways of reaching our family planning target population. So please, I would urge everybody, please let's prioritize HIPs, let's look out for HIPs, and let's by all means incorporate them in our programming. It will save a life. Thank you.
Thank you so much, Lois. And Dr. Feston, if I can and move to you next.
Yes, thank you. And thank you for inviting me again. The HIPs and the WHO tools are evidence-based materials. We need to have the most updated evidence in order to make sure that both these materials and the matrix eventually will be the most updated resources. So, but the evidence for that will be coming from your experiences, your documentation of what happened in when you use these tools, either the WHO or the HIPs. So please document your experiences with using these tools so we can use them as evidence for the next review of the HIPs and the WHO guidelines and tools. So you can input also and help us improve our materials. Thank you.
Thank you so much, Dr. Feston. And we'll also flag that the Knowledge Success Project has a lot of great resources to encourage you all to document best practices and how-to guides on how to do that. So we can certainly share our website down below as well. Thank you, Dr. Feston. And Dr. Said, if I can move over to you.
Yeah, no, thank you. I think I will build on Mario's point on documenting, but taking it a step further to really publish these findings, the implementation experience. It's not just documenting, but making sure the other colleagues elsewhere can read your work in a peer-reviewed process. And the second point, I think we've answered it in one of the questions, is country context. It's not just taking the HIPs, but really having that intentionality in identifying the HIPs that will be best fit for the country need and country priorities, and using a data-driven process to identify those HIPs, and with the leadership of the government, and there's also the discussion around HIP implementation and scale-up should be part of the agenda for the RH Technical Working Group or equivalent groups in countries that will continue to drive the process for implementation and the learning experience from scaling high impact practices alongside the adoption of WHO guidelines and national programs. And colleagues should provide feedback to the Secretariat or to the technical advisory group for the HIPs on any experiences or challenges that countries face in this implementation process. And yeah, we welcome feedback always on how countries are making on some of the challenges, and how the donor group and the HIP Secretariat and the technical advisory group can identify and help countries address those challenges in the implementation and scale up of high impact practices alongside WHO evidence-based guidelines. And thank you for this opportunity once again.
Thank you so much, Dr. Said. And thank you so much to all of our panelists today for your really thoughtful answers and for sharing your expertise with us. Knowing that we're coming to the end of our time together, just want to be mindful to close out our discussion here and move to our final slide, where we have a few closing resources that we'll be sharing with you. As a reminder, again, this entire conversation and our presentation today was recorded in both English and French. And so this will be located on the Knowledge Success YouTube channel, which we can share in the chat here, and we'll send in an email after today. And then just another encouragement to please go view and explore the Matrix tool to learn more about how it can support your programs. And we'll be sending out a comprehensive list of many of the resources that were covered today, including how to get involved at ICFP and other links that were shared in our follow-up email. So once again, just want to say thank you so much to everyone, to our panelists, Ados, and all who came to support today. We're so grateful for you spending an hour with us this morning, afternoon, or evening. And so thank you so much, everyone. I hope you have a wonderful rest of your day.
Bye.
Bye, everyone.
Right. Thank you.
Hello.